and welcome. Can everybody hear me? Oh, good. Tell me if I'm sort of lowering my voice because I know I've got a very loud voice. So if I start talking too loudly, you can sort of make a gesture to make it quieter. So welcome to this Adapting Services and Pathways stream. Thank you for coming along. My name's Caroline Hurst. I am part of AutAngel, which is a Reading-based autistic-run community interest company, and we run groups and services for autistic people, including what started off as being called started off being called post-diagnostic program, and then we changed it to post-identification program, and we now call it Exploring Being Autistic and accept people who wonder if they might be autistic, so they don't even have to identify as autistic. And I think that reflects the level of stigma associated with autism. And what we found on our program is nobody who's come along wondering has left not thinking that they're autistic. Some of them, for the first few weeks, have been very keen on saying all the bits of autism that we're identifying don't apply to them. And then gradually they felt more at home in the situation and finally identify as autistic. I am saying this because I just think for services and pathways, the most important thing is a positive understanding of autism by generic practitioners. And unfortunately, that doesn't currently exist, so that health professionals who are going to be the gateway to further services need to understand autism, and it is quite shocking the degree to which people are still being told by GPs that they can't be autistic because they have looked somebody in the eye or they seem like a nice person. And this really does happen. You know, if I wasn't being told this on a regular basis, I wouldn't necessarily believe it. So the initial point to me is that generic practitioners in any health service need to have a very good grounding in autism, and then there would be less need for so many specific pathways. And another thing that I would just like to say is that the program we run is autistic run and autistic led, and that is vitally important to the people. The feedback we get is vitally important to the people on that program. And I was just speaking to somebody this morning who I just met at this conference who was saying that she had got a diagnosis and she felt very frustrated, and she'd previously worked within the health field, and she felt very frustrated by the sort of help that she was given by somebody who was assumed to know about autism because they had adult autistic children. And this person basically, they interviewed her in a room which had somebody else sitting there typing in it without any introduction. So, as I'm saying, the thing that I would like to stress about services is just that a half an hour on autism isn't adequate training for people who are working in any form of generic service. So from that, I think we would like to hear from the real presenters here. So it's Alexandra Karousi, is that how I pronounce your name?
Okay, so good morning all. I'm Alexandra Karousi from the Human Science Research Center of the University of Derby, and along with my supervisory team, Drs. Simon Bicknell, Sigrid Lipka and Chris Burns, we're exploring how parents understand autism via an individualized autism profiler. I'm currently in the second year of my PhD research, so today I will present to you an overview of the research studies, as well as some preliminary findings from my first study that has been completed. So what we know is that higher levels of stress and psychological distress have been found in parents of children on the autism spectrum rather than parents of children with other types of conditions. So the needs of parents of autistic children is to make sense of the nature of their child's strengths and challenges, and to secure the necessary service and support for their children and their families. Yet, an evidence-based tool that can bridge the gap between diagnostic clinical descriptions and unique child's characteristics is currently absent from the literature. And this is where this research comes. So our aim is to develop an evidence-based profiling tool that will bring together multiple sources of data about the child's individual characteristics and their specific relationship to autism and comorbidities. What is really important here is that the profiler will be informed by parents of autistic children and the Autistic Society, autistic people, so their involvement and consultation in all the stages of this research is vital. So, as I've mentioned, this is a PhD research. We're talking about a 3-year PhD project. So there are 3 different studies. The first study that has been completed, it was the exploratory phase and investigation into parental understanding of autism. And this was achieved via an online survey and interviews to parents of autistic children. Following on to the second study, we have the analysis and interpretation of the survey and interview data, and that will inform the development of the individualized autism profiler. And the last study is the validation of the profiler on a larger scale with other measures such as parenting self-efficacy, well-being, and quality of life. So a bit on the methodology of the first study. It was divided into 2 main phases. So in the first phase, a self-administered questionnaire has been developed by the research team, and it was informed by parents of autistic children. That was on the pre-study, and the questionnaire had been informed on the suitability of the items that have been included in the survey. So the survey itself was roughly divided into 2 main parts. So in the first part, we were asking questions about general understanding of autism and characteristics of all children affected. And on the second part, we were asking questions about their own child's characteristics and behaviors. We had 300 full responses and then some follow-up interviews to help the interpretation of the survey data. So here's an example of how the survey looked like online. So we're talking about a 7-point Likert scale from strongly disagree to strongly agree. And as you may see in this question, we had several items up to 5 that the participants had to respond to. Okay, so at this point I would like to present to you some preliminary findings. The analysis is still ongoing. However, we ended up from the analysis with 3 factors. So the items were clustered together in 3 different factors, and on how parents understand autism. And in the first factor, named autistic children's eating behavior and interaction with the environment, we have items from the general part of the online survey. And on the second factor, my child's social communicative behavior and autonomy, as well as on the third factor, my child's emotional and social adaptation skills, we have items from the understanding of their own child's characteristics. So I just want to present you an example of how the items look like together in one of the factors. So here we have the second factor, social communicative behavior and autonomy. And as you may see, there are a couple of items on the social and communication skills. For example, my child prefers solitary play, or my child is not able to share their thoughts. And some items on self-care. My child requires more help than other children of their age to get dressed or undressed. And the factor was named social communicative behavior and autonomy. However, as I've mentioned, the analysis is still ongoing, and along with the interviews, and as we move on to the second study, we will soon have a clear image on how these preliminary findings would look like. Okay, so to summarize, our message is that we are aiming to develop an evidence-based tool that is currently absent from the literature, so that's why the involvement of parents of children on the autism spectrum and autistic individuals is really important to us. The application of the tool will be for parents, autistic people, and professionals. The tool itself is aiming to inform highly individualized intervention strategies and to help parents make sense of the nature of their child's challenges, secure the necessary services and support, and have a good quality of life. If you would like to learn more about this project, or if you would like to take part in the next studies, please follow us on Twitter or at Parents Understanding ASD on Facebook. Thank you.
Thank you for a really informative talk and work going forward to help parents and children. That's great. So do we have any questions about that? So, yeah.
Thank you. Hi, my name's Tara Rosso. I'm an occupational therapist. I'm just interested to hear a little bit more about how you imagine this going forward in kind of a practical sense for professionals like myself. Obviously, we're a little bit away from that. I know there's a few more years to go, but what's kind of the kind of ideas moving forward? Is this going to be used in schools, in kind of diagnostic services? How do you kind of imagine that happening?
Yeah, so to be honest to you, I don't really know how the final tool will be, but we hope to be an online tool, so everyone would have access to that. So if we think of it as an AI engine where you have your input and output, then that could be informed and updated online, so everyone could have access. Especially the autistic people or the parents, and probably after a diagnosis, this could be informative on the individual profile of the person. Thank you.
Any other questions? Yeah,
I've made him come up here now. I feel a bit guilty. Sorry, my name's Donna Sharland, and I run a company, and we deliver training to parents, and we also help them out at home as well. I really love this. I think parents have a lot of questions when their child gets diagnosed with autism, but I am a little bit concerned that sometimes when we look at characteristics and then we try to align them with clinical markers, that we miss that the child has got their own personality, likes, dislikes, passions, and development is also dependent on lots of other things outside of having that diagnostic condition. So I just wonder how you're going to incorporate that, or is that a factor in your research as well?
Yeah. Thank you for your question. That's exactly one of our considerations. So that's why we hope that with the involvement of parents in all the stages of this research, having these face-to-face interviews, we could be able to take out some more information about the individual child. We also had a part on the survey where the parents were able to write their own text about how they feel about their child or about specific behaviors that we probably haven't mentioned them on the questions on the survey. So all this data will be definitely used on the final profiling tool.
Amazing, thank you. Good luck with it as well.
Thank you.
Any other questions? Oh, well, I will throw one in. So, do you have any input from autistic adults as to what they would have wanted or what they feel their profile would have been growing up?
Actually, we had a lot of parents who were themselves autistic adults, and we are also aiming to. So now we're moving on to the second study, which is the development of the tool. So when the tool will be ready and when we are going to get it out there and test it, we will consult them again. We will consult the Autistic Society and the parents. So hopefully we will have their involvement in our next stage.
Okay, thank you.
Thank
Thanks
you.
very much for
Thank you.
a very informative talk. So our next talk is developing digital health resources, and we've got Jacqueline. Have we got this?
Yeah.
Jacqueline Sin and Susannah Hermaszewska. Sorry, I'm not sure I've said this right. Hermaszewska.
Okay. Thank you for that introduction. So we're here to talk about the ideas and perspectives of parents of autistic children with regards to the design of a digital health resource. So online interventions are becoming increasingly popular methods of flexibly and efficiently disseminating information and care. However, there is a scarcity of evidence-based online resources for parents of autistic children. For the resources that do exist, there is a lack of insight into their effectiveness and their essential ingredients and their optimal design. So, So what we wanted to find out from this study was some initial thoughts from parents of autistic children with regards to the design of an online resource and what they would most like to go into it. To do this, we ran a focus group of 17 participants. We ran 5 focus groups in the London and Berkshire area, and we performed a thematic framework analysis. So here we have how we kind of constructed the analysis. So at the bottom, we have quotations from the parents, and every quotation is given a code which kind of encapsulates the content of that quote. And you can see in the brackets next to latest research updates, there's a number 8, and that shows that this kind of quote with this content was brought up 8 times in our discussions, showing that actually having latest research updates is really important to the parents of these children. I'm just going to move on here. So the key when we derive 4 key components from what parents were talking about and sharing their ideas. The first is online discussion forums. There are numerous online discussion forums already out there for parents of autistic children. However, one thing that we found that distinguished what the parents were saying from what already exists is that they wanted discussion forums that provide direct access to clinicians. So through online appointment stops, online drop-ins, leave a question, receive an answer, create a knowledge bank. For pathways to diagnosis and services, parents wanted more easily accessible, locally relevant information. There's lots of stuff out there, it's really hard to navigate. Parents wanted to have a resource hub, which kind of ties in this idea that there's loads of stuff out there, but actually they wanted to have everything able to be found in one place. So perhaps that would be a directory of websites, of existing resources, downloadable content, all in one health resource. And then in terms of research and therapies, parents wanted to have access to reliable summaries of therapies, of medication treatment, and also recommendations for their effectiveness. There's a lot of therapies out there that don't actually have much evidence behind them. In terms of delivery style, the key thing for parents was that it was safe. So especially with regards to online forums, parents wanted them to be moderated. So that would be moderated by experts to make sure that what's being posted and shared has some evidence behind it, but also to be monitored in order to prevent any kind of abuse. Parents wanted to have expertise in this resource to distinguish it perhaps from other resources. So that might be that it's accredited by a university, but also that that they can have access to professionals. And they want it to be accessible. There are a lot of hard-to-reach communities, and there are a lot of communities which are English as second language. So parents wanted those communities to be able to access this device. So, the implications and future directions. This study forms part of the theoretical development phase for a digital health resource to address the unmet needs of parents of children with autism. Despite all of the existing services, interventions, and resources, parents had a very clear idea of what was missing from them and what they would want to see. The overarching message from the focus groups was that parents are desperate for easier access to healthcare professionals and clinicians. They want reliable and credible information with regards to research, therapies and diagnosis pathways. They want information to be locally relevant, and they want to have everything in one place so that they can access it easily. Thank you for listening.
Thank you for a lovely talk, and hopefully that now you can garner the resources to put into action the results of your research. So are there any questions? So we can basically take one quick question. Anybody? Yep.
Sarah, autistic adult, working already on co-producing these resources with young people. It seems a bit limited to limit it to just what parents want when these young people, when they get to like 12, may have the competency to access these resources themselves and need them. It's not just parents who need support, it's the young people, and it seems a bit odd to limit it in that way.
Thank you for the question. When we started doing the focus group study, we were just recruiting parents, but we did think as a future step, actually, we need to run more of the groups. We run 5. And actually, during the focus group, even just including parents themselves, they were actually quite keen, exactly as you say, depending on the age of the kids, that may be a session for the kids themselves. And also, actually, parents themselves actually want staff, clinicians, or people working in school, people working in even a sports center. It's like some session of the online resource will be open to them, just for people to say they can tell someone, go and look at this. This is what my kids needs, and you should know about that. So yeah, we can actually see down the line we need to run multiple groups with different stakeholders, and actually very important, include them in when we get to the co-production stage. Thank you.
Thanks.
Thank you very much. So our next speaker is Alison Doyle, talking about anxiety in individuals with a PDA profile.
Sorry, it was under another name. Okay, good morning everybody. I'm here to talk to you in 5 minutes about a national project in Ireland. This has been run through by myself and my colleague Neil Kenny through Dublin City University's School of Inclusive and Special Education. It was commissioned by PRISM DLR, which is a Dublin-based family support group, and it's been funded by the Irish Research Council. We were very interested in March 2018 when we saw the results from the PDA Society National Research Project. It was responses from approximately 1,500 individuals who experienced extreme demand avoidance. We recognised that some of our anecdotal knowledge of extreme demand avoidance in Ireland very much reflected their findings. So we approached the PDA Society and requested that we might replicate their survey across Ireland. So in that effect, we are trying to map the experiences in the UK onto experiences in the Republic of Ireland. Some previous research, which I'm sure you're aware of, this informed the way in which the language we used in the survey. So it wasn't confined to pathological demand avoidance, it was extreme anxiety-based demand avoidance and intolerance of uncertainty. We took this from a triangulated perspective, so we rolled out the survey that was based on the PDA Society survey, but we also incorporated individual interviews and focus groups. In terms of the funding, we were commissioned at the end of this research project, so starting in November, to 3 to 4 regional dissemination workshops or seminars, a national conference in Dublin in January 2020, and to not rewrite the very, very valuable guidelines that are provided by the PDA Society, but to reframe those in the context of Ireland, as we have very different education and health systems. So this is a mixed methodology where we are mixing both quant and qual information, both in the online survey and in the interviews. And out of that come some descriptive statistics. We only actually finished extracting the data on Friday, so I have some quite low-level descriptive statistics to show you today. But we hope to show a full complex, can't think of the word now, breakdown, thank you, at Autism Europe in September. So our thematic framework, we use very much the themes that the PDA Society took. These informed the way in which we structured the questions, particularly during the interviews, but we're also using a kind of hybrid thematic analysis. So we have these 5 a priori codes, but we're also using posteriori codes to see what other themes are emerging. So our sample population in terms of online surveys was 264 parents, 53, now 54 actually, professionals, 10 individuals who identify with PDA, and 6 life partners, living with people who identify with PDA. As perhaps not unexpectedly, most of the responses came from Dublin, although we did get some reasonably good national coverage as well. We were a little disappointed by the number of individuals with PDA. It's been quite difficult to engage this group. Possibly that's something to do with population size. The population of Ireland is about the same population size as Yorkshire. There are a lot of autism research projects, and it's possible that there is an exhaustion from the autistic community being asked or requested to engage in research. In terms of the individuals with PDA, we thought, as we have such a short amount of time, this is who we would focus on. Mainly the responses came from age group 41 to 50 years, mostly female, mostly living either on their own or with a life partner or with their parents. All of those people graduated from school, got a leaving certificate, which is the equivalent of A-levels, completed an undergraduate and postgraduate qualifications. But this is where we started to see challenges of managing PDA coming in terms of life outcomes and work, for example, having to give up work or having to reduce their hours. In terms of engaging with therapies or interventions, there's some very mixed results there. Access to mentoring and guidance, but no early access really to many of the therapies. Quite a lot of support from their local GP and adult mental health services. No real support from social care, and also none, but I think I would have benefited from some of these. Some of the more interesting questions were in terms of how daily life was affected by any of the following. And here we can see that this is where anxiety really has an effect on other aspects of life. So anxiety and sensory issues leading to depression and low self-esteem are affecting managing daily work tasks and this need to feel in control. I have 1 minute. We did ask our individuals what was the biggest challenge that they felt they experienced in life. Just living, not coping at all, I'm scared and ashamed, most people dismiss my problems, losing everything I have ever enjoyed. The online actually autistic community has saved my life, and I often feel like a prisoner in my own home. And so these are related to the barriers. These are barriers that all of those respondents expressed. And it is reflective of what some other people have said this morning in terms of failing to discuss and listen to experiences, to be understanding and accepting of extreme demand avoidance and a refusal to provide services. And this has a long-term, a lifelong impact on individuals, which is why we are so anxious to speak to more autistic individuals who experience this extreme demand avoidance. So we will be, although we finished the online data collection, we will be redoubling our efforts to engage with that community. In terms of parents, mostly they were parents of primary and post-primary children, and I'm now out of time, and yes, indeed, they do struggle to stay in school, etc. Those are references, and if you have any questions, thank you.
Thanks very much. I do understand that you had a lot of material, and PDA is a vast subject, and you did brilliantly to précis some of it into that short time. We've just got time for one very quick question. Okay. Is there a quick question that's... Okay, this person here.
Thank you. I won't introduce myself because you know me. I suppose... Well done, first of all, for getting through all that in 5 minutes.
Not everybody knows.
Oh, sorry. Oh, yeah. So I'm Fiona Ferris. I'm Deputy CEO of As I Am in Ireland. We heard talk about in Mary Tardy's presentation. I suppose how would you like the data from this research to be used? What would the ideal end outcome be for you in terms of recommendations?
Well, what we would like to recommend is that. Do you want to respond to this? We're very much hoping that we can extract some recommendations for healthcare providers and most importantly for teachers and schools, because coming out of the data, one of the biggest challenges is not being understood in school. It has a gigantic impact on school retention, and certainly many of the young people, teenagers that I work with, are not in school and have not been in school for several years. Mm-hmm. So that is one of the, I suppose, most pressing thing we'd like to come out of it.
Yeah, I mean, a lot of things that people, teachers, clinicians, or people who work with young people or young adults think they should do for somebody with a diagnosis of autism is not necessarily in any way helpful or counterproductive for people experiencing the profile around demand avoidance. So knowledge, getting it out there, because most people have never heard of it.
Yes. I think that's it, that techniques that usually work with autistic children do not work with this cohort. Yes. They require a different
totally
type of funding. Anyway, thank you.
Thanks very much. And hopefully you'd be willing to answer questions later if people were to see you. So our next speaker is Indu Dubey. Oh, right, there you are, sorry. Great.
Okay. Hello everyone. So I'm going to discuss some of the insights that we have from START project, a mobile computer-mediated assessment of autism risk that can be used by non-specialists in home settings. So this project is a product of a collaboration between different universities, clinicians, researchers, scientists, people from gaming company, IT experts, NGOs. So a big collaboration has come together to produce this app. And the aim of the project was to develop a mobile, modular, open source platform for early detection of autism risk by non-specialist worker in low resource settings. So it's a lot to take from there. Basically, we wanted a tool that anybody with a minimal training could take out in the field and screen children who might be at the risk of developing autism. And this is the project. It's an app that runs on Android tablet devices. It's open source. It's now translated in 11 languages, and it requires very minimal of instructions, and that's the reason why it can be used by health workers who are minimally trained. And the best part is that it gives a holistic, multi-dimensional evaluation when used with any child. A novel feature of this tablet app is that it uses the front camera of the device to track the eye movement of the child while they're doing the task, and as some of the research suggests, that longer fixations are indicative of visual preferences. So we have used the camera-based eye tracking technique to understand some social behaviors. Since we have very limited time, I'm just going to give an overview of what is included in the app. So this is the task battery which is included. It has 2 tasks that evaluate social motivation, 1 task that focuses on evaluating hypersensitivity, sensory sensitivity, 3 tasks to evaluate any specific motor signatures or motor atypicalities in autism, 1 task to evaluate cognitive flexibility. Then we have a short questionnaire, a 14-item questionnaire to identify red flag signs of autism, and then it allows to capture 10 minutes free play video between child and parent that can later be coded to identify the behavior relevant to diagnosis of autism. So we have so far collected more than 200 data from more than 200 typically developing children, and this data was used to improve the app and to make changes, and we have 114 versions of the app. The 114th version was then finally accepted by everyone and was used to collect clinical data. And the data was collected by health workers who went out in the field, in the home settings, and they collected data from 40 autistic children, 40 typically developing, and 40 children with intellectual disabilities. This is just a summary of a few results that I could put up there. So when presented with the visual preference for social or non-social stimuli on the screen, we see that autistic children, they look at the non-social stimuli more, and they look social stimuli much less than the typical children. When given a sensory stimuli, they look at the sensory stimuli for much longer than the typically developing children. And on a motor following task, when they have to follow a dynamic target, they are likely to make more error than a typically developing group. And finally, on the questionnaire, we see there's a clear difference between how autistic children are scoring much higher than both typically developing and children with intellectual disabilities. So this is just a summary of all the other task results that we have available, and we consistently see that all these different tasks, which are generally a minute or 2 long, are able to distinguish between typical children and autistic children. And however, there might not be much of difference between autistic children and children with intellectual disability. So overall, we can say that this study provides proof of principle for START, revealing the expected pattern of ASD and TD group differences, and it also shows the feasibility of a mobile scalable testing of neurodevelopment by non-specialists in home settings. Thank you. And these are all the collaborators who have contributed to this project.
Thank you very much for a very quick précis of an interesting topic. The one thing I would say, actually, is as an autistic person, it would be lovely if instead of talking about the risk of autism, you talked about the likelihood of autism. Mm-hmm. So do we have any questions? Yeah.
Just add on to your comments, not the risk of developing autism, but the likelihood of being diagnosed instead. So,
right.
Yeah.
Well, it's true also you don't develop autism. you have it. Yeah. So that's currently, is this currently in use, this?
So at the moment we have tested it and we are analyzing the results and going to publish it soon, but the moment the results are out, the app will be available for different research groups to use it. Yeah.
So it's a research, so it'll be a research tool, essentially.
Well, it's a tool that can be used by anyone, but it will need a full resources, so you can't just download it from Google App. It needs its cloud where the data will go, and somebody needs to look after that. So it is a research tool, but it can be used by clinician group as well, but it will need much more resources than just Google App download.
Okay, thank you. Oh, sorry, yeah, there's a question right at the top there. Then we're... This needs to be quick, sorry.
Yeah, sure.
Hi, sorry. Could you, on your last slide, I think, there were two items that distinguished, or appeared to distinguish autism from intellectual disability. There were just two, I think, that didn't where the...
At the moment, the only thing that questionnaire is the only bit that is able to distinguish between autistic children and children with intellectual disability. But for rest of them, we are not distinguishing.
Okay, and the PCI, the parent-child interaction, is not included on that slide?
Not yet. That data is not coded yet. So.
Okay, thank you.
Thank you.
Many thanks. Thanks a lot. So our next speaker is Edmund Coleman-Fountain, great, who's talking about understanding health seeking for mental health amongst young adults with Asperger Syndrome. There you go. Where am I speaking?
Thank you.
Yeah.
Yes, my name's Edmund, usually shortened to Ned. I'm a non-autistic researcher, so I'm here to talk to you about understanding non-help seeking for mental health among autistic young adults. I assumed I'd have a bit longer, and I prepared far more slides than I would normally have for even that amount of time, so I'm going to talk fast. So the project is, you heard Bryony speak earlier. This is a project that I was doing at the University of York at the Social Policy Research Unit with Bryony. It's called the Making Sense Study. The research question is, how do young adults with Asperger Syndrome make sense of and respond to symptoms of mental health problems? So it was a qualitative research project where we looked at accounts of mental health. We explored some of their experiences and how they made sense of and talked about those things. The project I'll briefly mention is part of the I Am Health NIHR programme grant, which is led by Emily Simonoff, which is looking at developing tools for early recognition, intervention related to improving mental health outcomes of individuals with autism spectrum conditions. So we did 19 in-depth interviews. We interviewed 17 young men and 2 young women aged 23 to 24. These were recruited from an existing cohort, and we used a purposive sampling frame to get a spread of experiences of mental health experiences. So we had pre-existing data from the research, which we were able to use to select people to interview based on their experiences of anxiety, depression, and obsessive compulsory issues as well. So we used the Beck Anxiety Inventory, Beck Depression Inventory, and the Obsessive Compulsive Inventory to help us, just so we had people in there who had things that they were able to talk about. So as you can see from this, we had a fairly good spread. It wasn't very even. It wasn't, there's a mix of stuff in there. We did interviews. We facilitated these using autism and emotion cards. These are cards which were produced in collaboration with project advisory groups, and they had words on them which the advisory groups associated with autism and with mental health. So things like anxiety, things like depression, thanks, Bryony, things like stress, things like that, but also words that were indicative of autism. So things like social challenges, all of that kind of stuff. I'd sit down in the interview, or my colleague Wendy would sit down. We'd get the cards out, whip them out, and they'd kind of pick them up and they'd say, oh yeah, that's me, that's not me, shuffle them about a bit. And then once we got the right cards, we talked about them. So that was a way of facilitating and beginning to hear those narratives. We did a thematic analysis of the interview transcripts, themes agreed within research team, and explored them for meaning with advisory group members. The kinds of themes we explored were the range of experiences, broadly anxiety related, things to do with mood, depression, and other stuff, frustrations, fixations, etc. We talked about beliefs about mental health and autism. What's the relationship between mental health and autism? What causes mental health issues in autism? We've looked at ways of managing and views on help seeking. So this is the data I want to show you relates to these last 3 issues. there was a project recently about the Laura Crane and stuff, Know Your Normal project. We heard a lot of stuff along those lines, that notion of difference, their experience of mental health being different, normally experiencing stress perhaps at a greater level, maybe more frequently, maybe for longer. It was something that felt like it was common and something which they felt was part of their lives, bearing in mind these are 23, 24-year-olds. And a lot of times they talked about, well, how and why do I experience those things? They identified a lot of autism-related triggers that might help explain them. Things like intense socialising periods. Anyway, I'm going to move very, very fastly. Self-management was an issue. There was a preference for looking after things themselves. There was indication that they would talk perhaps to friends, perhaps to family, but on the whole it was, I'm better off going to my bedroom. I'm better off playing a game. I'm better off engaging in this little task because this is the thing that helps me manage. And if I said to them, well, would you go and seek help? Well, I'm just not sure about it. I don't know what's on offer. So this is the kind of last slide I want to do. There was a tendency not to disclose, to be self-reliant. I never spoke to anybody about it. I just bottled it up. For some, approaching primary professional health services was not the primary option. I don't know if I'd be inclined to do it. I don't know if they're going to, what is out there? I actually don't know. Are they any good? Are they going to be able to help me? That was an issue. And yes, so there was just general sense that wasn't something for them. One of the issues they did come across was, well, sometimes they did have experiences of getting support. That support was sort of non-autistic specialist support in schools. A counsellor, somebody would sit down and talk about them. Experiences were usually pretty poor. Parents found them pretty poor, didn't find them very helpful. And that kind of bounced back. So it came back when they were older. They'd say to their mum, would I benefit from this? Well, I don't know, actually. So that was kind of what we were talking about. It was the relationship between the experience they did have, their understanding, well, this is something that's normal for me or something that I experience a lot. I need to know how to manage. I'm going to do it on my own, or that at least appears to be the context. Anyway, I'm going to leave it there. Thank you.
Many thanks for, taking on this challenge of condensing all this information. Very difficult, I realise. Okay, so we have basically got time for one quick question. Have we got a question that somebody would like to ask? Edmund.
Were there positive experiences that they shared?
Were there positive experiences? Yeah, I think, to be honest, I think that's a really important point. I can't sort of pluck one out of my head. Yeah, but I think that's a methodological question about how we approach the interviews.
That's it. Thank you very much indeed. Thanks. So we're now going to hear from Kathy Leadbitter about parents' reflections on taking part in Paediatric Autism Communication Therapy. Thank you.
Hi, I'm Kathy Leadbitter from the University of Manchester. It's a great pleasure to share with you this work, which is a qualitative study which formed part of the preschool autism communication trial and our wider body of work, which was introduced by Jonathan Green in his keynote this morning. So PAC therapy targets the interaction and communication between a parent and their young autistic child. The therapist makes a video of the parent and child playing together, and then the therapist and parent watch the video back together, and the therapist supports the parent to make careful observations of the interaction and to tailor the way they interact to the level, style and pace of the child's communication and to respond to the child with increased sensitivity. So the aims of this qualitative study were quite simply to find out what parents thought about the therapy, including their own experience, reflections on the therapy processes, and whether they thought the therapy brought any benefits or challenges to them as parents. Participants were 18 parents. Semi-structured interviews were carried out by a researcher who was independent to the trial and therapy teams, and we analysed the data using thematic analysis. I'm going to focus on 3 of our findings today. The first one concerns a period of initial adjustment to the therapy. So parents described that in the initial therapy sessions, they kind of went through a period of adjustment. And that included an initial discomfort of being videoed and of analysing video material, perhaps not surprising, but also an initial unease with the therapy aims. So some parents described that they wanted to be teaching their child, they wanted to be engaging their child in educational activities. So there was an initial tension between this and the very child-led approach that PAC therapy is. Parents also talked about an initial impatience. So some parents were looking for a bit of a magic wand, they were looking for instant results, and it took time for them to realise that this wasn't going to be a quick-term fix, this was a longer-term approach. The second finding concerns therapy processes. So parents talked about how much they valued the relationship with the therapist and how much validation that gave them as a parent at a time when they felt very disempowered and judged by other people. Then they talked about the benefits of the video feedback once they'd had time to get over the initial discomfort. And they described that as tangible. They like being able to see very clearly what the interaction looked like, and also revelatory. So they saw things in themselves, which came as a surprise, and also saw some of the more subtle communicative signals that their child was sending that they weren't aware of. And then they talked about adopting a different interactional style. So they talked about a steep learning curve, but that over time they could see themselves on the videos interacting differently with their child and in a way that was more sensitive and responsive. The third finding is about parent outcomes. So parents talked about the difference that PAC therapy had made to themselves as parents. So they talked about an increased understanding of and empathy with their child. They talked about improved confidence and empowerment as a parent. They also talked about the way in which PAC therapy had strengthened the relationship they had with their child. And this was one really lovely quote. "I have always loved my son, but I fell in love with him after PACT." A small number of parents, after the end of the therapy, also talked about some ongoing struggles. So struggles with coming to terms with their child's diagnosis, struggles with the realisation of the extent of their child's needs. Many parents had hoped that their child would quickly start talking as a result of the therapy and experienced some disappointment if that didn't happen. So to summarise, this qualitative study has found that PAC brings real and sometimes profound benefits to parents and to their relationship with their child. And these emotional and relational outcomes for parents haven't really been clearly evidenced in our quantitative work. Therapists delivering this kind of therapy can expect some initial discomfort with the therapy style and video feedback. However, most parents come to really value the therapy and embrace and adopt the approach. However, some parents may need some more targeted support with their resolution to their child's diagnosis before they're able to fully embrace an approach like PACT. Thank you.
Many thanks for a really interesting talk with a lot of light and shade, so that was great. Thanks. Are there any questions? We've just got time for a couple of questions. Yep.
Hi, my name's Tim Nichols. I'm from the National Autistic Society, and the PACT stuff is something that's interested me ever since it first came out, because I think it shows a really interesting model. But one thing I've always wondered about is, presumably you've got a cohort of children who are roughly sort of similar ages and presenting in the same kind of way. So I guess my question is, how applicable do you think the model is across a more diverse range of needs for those kids who aren't presenting as typically atypical? If you see what I mean.
I see exactly what you mean, yeah. And so the PACT trial included children 2 to 5 years who had what we called core autism, so they met the autism threshold on the ADOS assessment. So yes, they are, they're not representative of the wider spectrum. There may be a question mark over the applicability of PACT therapy to sort of the wider spectrum of need. We are currently looking at, I think Jonathan mentioned it this morning, a kind of adapted PACT therapy to a wider age range of children, going up to 11 years. And we've also used a similar kind of culturally adapted approach within India and Pakistan, and that was with children up to 9 years who weren't quite so carefully defined. So yeah, we don't have all the answers, but we're trying to look at how it might apply to different groups.
One final question which popped out.
If it's all right, I just wanted to, from the PAC group as well, and I just wanted to respond to that previous question by saying PCI as a model of intervention, including videos, is widely used in children with language disorder, communication impairments, and other neurodevelopmental disorders. So it in terms of applicability to a range of presentations, I think the evidence is emerging that ways of enhancing the unique dyad and the way they communicate with each other are beneficial to children with any communication impairments.
Great, thank you. Thanks a lot. Many thanks. So we now have Danielle Roper, Chloe Hocking and Sophie Phillips talking about creating a more accessible environment for individuals with neurodiverse needs in the criminal justice system.
Hi everyone, so that was my previous name. I'm Dr. Chloe Holloway from the University of Nottingham. I'll be speaking with Dr. Danielle Roper, who's also from the University of Nottingham, and Sophie Phillips from the University of Sheffield. And we're kind of going to be talking about my PhD research and the follow-on study that we've done, which focuses specifically on autistic individuals in police custody, and some of the broader implications that has for supporting individuals who are neurodivergent more generally. So brief outline, I'm going to talk about my PhD research and the findings from that. Sophie's going to talk about kind of our follow-on study and some of the changes we've started to implement on the basis of those findings and her experiences of being involved in that project. And then Danny's going to briefly talk about kind of what we learned from doing the research that way and where we might go next. So in terms of the research, a little bit of background to why I conducted the research in the first place. The figure that's kind of thrown around is that autistic individuals are kind of 7 times more likely to come into contact with police. And that's not just for offending behaviour, but also a wider risk of interaction, perhaps to do with miscommunication between police officers and autistic individuals, reactions to high stress situations, and also just kind of more general responses to them. But also the literature is kind of showing that the support that is in place in police custody doesn't work for detainees generally, but perhaps specifically for autistic detainees is even more problematic. But actually there's very limited research prior to this about actually whether that support was working and what needs to be in place. So my research sought to explore, well, if it's not working, what support do we need in place to ensure that autistic individuals are able to participate in the custody process effectively, and ensure that they have really good outcomes when that happens. So I conducted 3 studies to kind of learn more about first-hand kind of voices and lived experiences of autistic individuals in that setting. So we conducted interviews with autistic individuals who'd been arrested and detained previously, an online survey which was developed with autistic individuals, again with the same population, and also a participative walkthrough, which was kind of an opportunity to co-produce data with autistic individuals and custody staff in a custody setting. So we kind of walked through the process identify potential barriers to participation and what changes might be needed in that setting. So a really brief summary of the key findings there. The findings kind of illustrated that autistic individuals can have very, very negative experiences in custody, which can often lead to very significant legal and personal outcomes. So we found that the participants that we had were suffering from very significant emotional impact as a result of their experiences, and often had kind of ended up with convictions and in situations which possibly could have been different if they'd been able to participate in the custody process more effectively. And then that also had an impact on their life afterwards in terms of employment outcomes, and et cetera, et cetera. So the reasons for this was that we identified barriers in police custody that affected their experiences and really did prevent them from participating in that process. And this kind of related to three key areas, and that was to do with understanding arrest and detention. And that was mainly to do with the lack of accessible and adequate information about the custody process. So being able to know what is happening in that setting, what their rights were, and really just what would happen to them while they were there, and being able to cope with that. Being able to cope with the actual demands of the custody process itself. Police custody is not a friendly environment at all for anybody. And so when you have additional differences on top of that in terms of sensory demands and coping with that, it can be really anxiety-provoking and have a really significant emotional impact on them. Particularly in terms of the environment, you know, there's very, very bright lights, very small spaces, a lot of noise, unpredictable things happening, and the custody process involves a lot of touching. So obviously this can be quite demanding for some autistic individuals. And then the impact of these two factors really did affect their ability to participate in that process, particularly in interview in terms of understanding and answering questions, and even just accepting and understanding what their rights were. A lot of them waived their rights to a solicitor, and that's really important because obviously when they went to interview, they didn't necessarily have the advice that they needed. So in terms of improving accessibility for these individuals, we identified a number of changes that could be made really just to make it more accessible in terms of participation. And that's to do with change in practice, broadly speaking relating to how police officers fulfil the custody process, so providing more information, accessible information such as visual flowcharts and things, changing the environment so that it's more accessible, removing and minimising sensory barriers, and also changing policy to ensure that it's not just in one or two forces in the UK, but across all forces, and ensuring that best practice is adopted by everyone. So following on from that, we kind of took one of those recommendations, which was the need for autism training for custody staff. And we kind of realised that, you know, it's not available, provision's inconsistent, and there's a need to develop more appropriate materials, particularly that reflect the priorities and needs of autistic individuals and also custody staff. So we received funding from Nottingham to develop those materials with autistic individuals and custody staff. And Sophie's going to talk to you about that project and her experiences of being involved in that.
So in order to create some materials, we created the Nottinghamshire Autism Police Partnership, which consisted of academics, autistic individuals and police officers. So I participated as an autistic individual in this. And so over 8 months, we had 7 focus groups, of which you can see most of them included all of us, which helped us to sort of co-produce resources. And so the aim of these was to feed back on drafts, to sort of think of the ideas that we wanted, and to work together to create them. And so these are an example of a couple of the materials we made for custody staff. There were many more than this, but for the purpose of this presentation, these are sort of 2 key ones. So on the left is a slide from a PowerPoint presentation to be used for training, so that police staff can better understand how to help autistic people in a stressful environment such as custody. And on the right is a picture of us creating a training video for police officers, which was based on the walkthrough from Chloe's PhD. And so in this, myself and another autistic individual walked through custody. So it was scripted, but to highlight areas which police officers may need to give autistic individuals more support, such as when being asked questions, not to ask questions that sort of are open, such as where do you live, asking more specifically. And these are a couple of materials that we made for the autistic or potentially neurodiverse detainees. So on the left there's a flow chart of the process and the sequence of custody, and on the right a more detailed, or that's a slide from a more detailed document that people could be given while they're in the cell waiting for the next bit. And so just my experience of it, I felt that I was fully involved in the project and that this wasn't a tokenistic approach to sort of including autistic people, because we all created the materials together, such as one of the autistic colleagues suggested the flow chart on the slide before. And so I think they would actually make a difference in custody when they're used.
Okay, I was just going to say a few things about what we learned about it. First of all, I learned it was really important to involve all stakeholders, so not just the autistic individuals to find out what they need, but also the police officers to find out how we could adapt the materials. And initially when we started the project off, we were going to have focus groups separate and then kind of feed back into it. Soon after the first couple, we realised we just had to have everyone in the room together, which was challenging, but brilliant. And it was really valuable and helped us make decisions much more quickly. Also helped each other to understand where everyone was coming from. Focus groups can be challenging, and I think it's important to consider how to be flexible and supportive. The group involved about 25 individuals. The picture only showed a selection of them. So we involved people in the project in different ways, not just in the focus group, but made ways for them to be able to input into it through the phone or email and other ways to get as many people's input as possible. And in final, involving autistic individuals in the research can provide valuable insights that would otherwise be missed by researchers. Several of the toolkit materials and even the video, initially our initial plans for it changed, and we had to apply for more funding to change it, would not have been in there if we hadn't had them involved in the project. Thank you. If you need to contact anybody about the project, there's some Twitter feeds. We're based at the University of Nottingham and Sophie's at Sheffield.
Many thanks. It looks like a brilliant template really for co-production. It's great that people really felt involved, and I know Panda Merry, who was on that photo, and he wouldn't have stuck it out if it wasn't real. Do we have any questions? Yeah, and then that gentleman over there.
I'm Charmaine, I'm from Fujitsu, and I'm also a mother of 2 young children who are both on the autistic spectrum. My fear is what you've just pointed out. My eldest is very physical, and my recommendation from my GP is if he gets too physical, is to phone 999 and they'll come and put him in a cell, which is a fantastic way of dealing with it. So what do you plan to do next? How far will this be rolled out? And I think it's a really good tool to put into schools, as well as putting it out into the police force and getting to the children at a younger age. So what are your plans going forward with it?
So at the moment, I've trained police officers in Nottinghamshire. We're then extending that to the wider East Midlands region. So we've just started using the stuff that we've developed. I delivered it prior, and we're now using the new stuff. But our aims are for that obviously to be adopted by all forces. So Tim obviously is here from the NES, but a bill's just been put into Parliament for autism training to be mandatory across police forces. And we're very keen for that to kind of reflect some of the stuff that we've developed, because we think it's really important that obviously it does reflect priorities of autistic individuals and custody staff as well. So obviously there's a long way to go in terms of getting all forces to adopt this training. It is necessary, but it's whether we go down the mandatory route or whether it's something that we is determined on a more local level. It's about stressing the need for it. And in response to kind of the schools kind of side of things, I know Danny's very interested in this. But obviously some of this is to do with the fact that obviously with custody and ending up in that situation, even we don't necessarily know what our rights are in that situation. We're not taught that at any kind of point in our life. So obviously we think actually it's really important to go into schools and talk to young children and say, if you're in this situation, this is what will happen and this is what your rights are, this is what you can do. So obviously it's about education as well. It's, it's not just on police officers, it's about educating society more generally about actually what is my responsibility and, what am I entitled to in that setting as well. So we do think it is a dual approach. So that will be something we look at in the future.
Hello. Oh, hi. Hi, I'm Jack Underwood. I'm a clinical research fellow, but also a forensic psychiatrist. And so I just want to say it's fantastic work. Is there will these kind of tools be shared or kind of shareable? Because we're coming at this we're looking at this from a more forensic and prison point of view, but it'd be really interesting to kind of see, is this being taken kind of further into prisons and kind of what can this be used for?
Yeah,
wider?
So I just recently attended the Appropriate Adult Network event and I had the exact same question there as well, and from other organisations and service providers, because obviously if those resources are available to service professionals who interact with police and things, because it is about joint working, I think we're kind of at the stage where we're deciding how we want to make these available. We do want them to be available to everyone. We don't want to just restrict it to Nottingham. We do want it to be available. We're kind of finalising the drafts now. So we are going to put them up on our website at some point in the future. That will probably in the next few months. And obviously, if anyone is interested, please do pass on contact details. So obviously, when they are available, we can share them.
Importantly, they'll be free.
Yeah.
They're not going to be packed or anything. So we will probably we're just finalising them, making sure we're not missing anything.
Oh, thanks.
Thank you. Great. Well, many thanks for that. That was really a great way to finish this session. I'm just going to, I will thank all of the speakers, but I'm just going to do a mini little promotion or suggestion that people might like. So this is a book that we produced, Angel, which is an autistic community interest company, and it is on sale, but it's also in the foyer. But we've also got copies to give to health professionals because it's a really useful resource to give for people at the point at which they're diagnosed or the point at which they're seeking a diagnosis or wondering if they might be autistic. So it's called Being Autistic, and it's 9 adults share their journeys from discovery to acceptance. So if you work for the NHS, or have contact with people who might be in a position to order this, please do come and get a copy from me. And other than that, it just falls to me to thank all our contributors and hope you enjoy your lunch.